Good afternoon, ma'am. So, for today's return demonstration, we will have a return demonstration about the whole brain scan or whole brain radiation therapy. The first thing to do is consultation. Uh, in consultation, you have to ask patients information. So, I will go ahead and proceed with the consultation process. So, good morning, ma'am. Today, I will be your radiation therapist. My name is Nikki Reyes, and I will be the one who will identify the procedures to be performed and also to identify your history and other workups. After identification and verification of your information, I will set your schedule for your city simulation for tomorrow. And also, I will inform you what you will do before the city simulation process or procedure. So, um, First, ma'am, may I ask what is your preferred language so that we can have a conversation? We can have an easy way of communication. So, okay. Assuming that the patient already said that his or her preferred language is English, I will go ahead and proceed with the oncology referral slip. So, imagining or assuming that the patient already gave the referral slip, we will go ahead and verify patient's information. So, ma'am, may I ask for your full name as well as your date of birth and age? Okay, thank you so much for that information, ma'am. Based on your referral slip, your medical oncologist, your medical oncologist refers you to undergo whole brain scan radiation therapy. Am I correct? Okay. So, ma'am, may I ask if you have undergo post-surgery or recent surgery? So, assuming that the patient have already answered all the questions, we will go ahead and proceed with the scheduling of CT simulation. So, ma'am, tomorrow I will set your schedule for CT simulation at exactly 8 a.m. sharp. If the patient will undergo contrast media, we have to inform the patient that they should fast for 12 hours. And if not, then the patient can, there will be no required of fasting for the patient. So, assuming that it's already the second day and at 8 a.m., before um, the patient arrives at the site, we should have to make sure that we have already prepared the accessories that the patient will use, including the head step and the overlay, which is composed of carbon fiber. So, also, we should not forget two pillows because the patient will be undergoing a whole brain radiation therapy, and the two pillows will serve as neutralizer for the patient's position or patient's head's position. So when the patient arrive at the site, we have to verify again the patient's name, and also we should ensure that we have the right patient. So we have to ask for the identification number or the unique number for the patient that have. So assuming that we have already verified and have the right patient for CT simulation, we will go ahead and proceed with the CT simulation process. So before making CT simulation process, we have to ready or prepare the thermoplastic mask. So in making the patient thermoplastic mask, we should always remember that the temperature should be at 70 degrees Celsius, and the time needed in the dipping process in the hot bath is 2 minutes. So after that, we will go ahead and proceed with placing the thermoplastic mask to patient's face. So Again, using a thermoplastic mask is pivotal because it ensures the patient's head should, it maintains or ensures that patient's heads remain straight and does not, it immobilizes the patient's head. So, during the making of mask, we need to provide patient's comfort. So, assuming that we have already done making the thermoplastic mask, that fits into the patient's head, then we will proceed to the plain CT procedure. So, prior to this procedure, we need to instruct the patient to remove any metallic materials such as necklace, earrings, and dentures. So, to ensure the patient's reproducibility and quality imaging, first, we should instruct the patient to be cooperative and relaxed. We have to make sure that the patient is comfortable because so that I mean because the patient's position will be the same on the next following days. So we have to make sure that the patient is comfortable. So also we have to achieve good patient instruction and communication to avoid um, any wrongdoings uh, during procedure. So we have to take extra care to construct an immobilization device to ensure accuracy because the mask that we will be using will be used as a marker during the treatment and the simulation process. So also we have to follow the manufacturer recommendations for making the immobilization device. So during the process, we have to straighten up the patient. We have to make sure that the patient's spine is aligned or is not tilted. And then to avoid repeat topogram or scout film. So in this plain CT, the patient must be positioned in supine. Positioning or position patient. Uh, I mean, Imagine that the patient has already worn the thermoplastic mask. We should guide and assist the patient to supine position after taking the plain CT because we need to proceed with the CT scan with contrast if the procedure is with contrast. So, the use of topograms are to help align the patient again in CT before and help also to make sure that the patient position is positioned properly. So, during the topogram, images are taken and the patient is aligned properly, as well as the radiation therapist can use the external laser system to place fiducial marks reference. So, when the when the thermoplastic mask is already placed, usually or most of the time they will use Sharpie as mentioned in the video, and they will use stickers as reference. So usually the 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 stickers are placed on the mid-sagittal plane of the head. So on the patient will be in a stable location because we have to make sure that uh, during the virtual simulation um, and the planning, because it will be used during the planning system, treatment planning system. So, to avoid any exposure to unnecessary organs, we have to ensure the patient's alignment as well as the placement of the thermoplastic mask because it will be used as reference for the um, oncologist or the physicist. So for CT simulation, topograms are imaging tools used for patient's alignment and to define the CT scan range. Also, we should not forget to make sure that in mid-sagittal plane of the patient's head, there will be markings, because that will be one of the most important things, specifically at the right and left center. So, for treatment planning, um, actually, we should open a file, but since I don't have any file here, I will just discuss it. So, in treatment planning, we should open the file and introduce the planning to be used. So, we will discuss about the treatment planning uh, on the whole brain radiation therapy procedure. So, for the radiation oncologist and the team, um, the goal will be to cover 95% of the planning target volume, or the PTV, and with a prescribed dose of 3,000 to 3,750 CGY in 10 to 15 fractions of 250 to 300 CGY per fraction. So the gross tumor volume, or the GTV, and the clinical target volume, as well as the planning target volumes, are contoured by the physician. So to be specific, GTV is defined as the primary tumor, including all the visible abnormalities demonstrated on MRI and resection cavity. Ang GTV also it should be delineated on every CT slice. So, on the other hand, CTV is the expansion, or CTV expansions are determined by the physicians, but expansions vary by tumor type. So, typically, ang natural boundaries sa tumor spread kay boundaries to tumor spread, such as bone, tapos ventricles and dura. So, for the PTV expansions, typically 3 to 5 mm ang margin niya around the CTV, depending on the comfort level of the daily patient's positioning, or patient positioning. So, typically, a smaller margin of 3 mm is used with daily image guidance. So, ang OARs, or the organs at risk, kay ginakontoured siya by the physician from a list of standardized names and colors. So, importante ang OAR kasi ang benefits niya, kay gina-reduce niya ang chance ng structures being overlooked, and by that, masave yung mga masave yung mga healthy cells. So, due to the average depth of treatment, 6 or 10 MV beam energies are typically used, although 15 MV can be used for large patients. So, the isocenter should be placed to accommodate the accelerator limitations with the dynamic wedge field sizes and multi-leaf collimator. So, meaning, ang beam daw ana comes from the left to right, or vice versa. So, left to right or vice versa. So, objectives kay dapat dapat makastart ang initial planning, or dapat ma-start ang initial planning na maka-include or i-include na ang those limitations ng OAR, or sa organs at risk. So, there are different na mga doses. Magbigay na lang po ako ng example. First is yung sa lens, 7 GY sa maximum dose. Retina will be 45 to 50 GY sa maximum dose. So, also, meron pang mga other na parts na or organs at risk. So, dili na lang nako to siya i-discuss, ma'am, kay medyo taas na po ang video. So, for the treatment procedure, during the procedure, ang technologies dapat ma-open niya ang patient's file muna, just to ensure that you have the correct patient. So, the technologist must set pre-program parameters, assuming that we have already prepared the head step and the accessories. So, we have to call the patient using the patient identifiers. For example, patients 503, so we have to call them using their patient identifiers because it is unique. Kasi sometimes possible na merong kapangalan yung patient. So, to avoid yung mga ganun na happenings, we have to use the identifiers. So, also, before ang treatment talaga, we have to make sure or we have to check the CBC of the patient and the vital signs of the patients. So, this will go. So, hello, sir. May I ask, sir, do you have a history of post-surgery? Sir, also, did you bring your laboratory results? Specifically, sir, your CBC? So, also, sir, can I see your vital signs? Uh, So, if assuming na napakita na sa patient, if ang CBC and the vital signs are low, the technologist must inform the physicist or the radiation oncologist para makabuhat or ma-instructionan ng patient. So, if the patient has high blood pressure, the technologist must reschedule the procedure and let the patient rest for 20 minutes. Pero, if the patient has uh, normal, you may proceed na with the procedure. So, if the complete or the CBC of the patient is below 100, sorry ma'am, below 100, dapat i-reschedule yung patient procedure or the brain or the treatment next week, and dapat i-advise ng patient to drink plenty of or to have rather plenty of rest. And if low pa rin yung blood pressure niya, the patient may undergo blood transfusion. So, assuming that the patient or my patient has a normal CPC and vital signs, we will proceed with the treatment procedure. So, during the treatment procedure, we should assist the patient into supine position, and we have to double check the parameters such as the couch, the gantry angle, the multi-leaf collimator. Also, we should make sure that the patient wear a fit, the patient should wear patient's mask, and additional instruction must be given to the patient para dili siya maglihok or dili maapektuhan ang treatment. So, we have to instruct the patient na ma'am, avoid any movements, para dili masaalang-alang ang mga other organs or dili ma-expose ang mga unnecessary organs. So, we have to say na, sir, during the course of our treatment, you need to be cooperative and dapat, sir, relax lang po tayo all throughout the procedure. Sir, we should not move, or please avoid doing unnecessary movements, especially to your head, lalo na if you feel uncomfortable. If uncomfortable po kayo, sir, you can just tell me before the procedure begins. So, before the procedure begins, we have to make sure that the patient's position or the patient is comfortable with its position. So, before the treatment, you should check the ISO center and then rotate the gantry about 90 degrees and verify the light field. So, we should start first on the left side, and then after that, we should rotate the gantry 270 degrees for the right side treatment. So, after ng treatment, we will softly remove the patient's mask. So, inform ang patient na, Sir, tanggalin na natin ang mask, and then also ask the patient for any discomfort feeling like burning sensation or any side effects. Tapos, after nun, always assist the patient off the couch. So, dapat i-assist ang patients patindog para dili maglisod ang patient. So, assuming that the patient already said na wala siya burning sensation or feeling ng any discomfort, the patient is good to go now. And don't forget to inform the patient or instruct the patient to have a plenty of rest. So, katulang ma'am, ang ako ang report. Sorry ma'am, kay wala ko'y patient karon. Thank you po.